This morning, the U.S. has the most reported coronavirus cases in the world.
I've never seen a health crisis like this before.
In New York, the number is skyrocketing, now more than 37,000, a triple-digit spike in deaths in just one day. Our station, WNBC, got rare access inside a hospital in the Bronx. The ER is packed. Patients with COVID-19 symptoms are isolated. Soon, this triage tent may be necessary. The city just sent 40 ventilators and dozens of more workers to Elmhurst Hospital in Queens. 13 deaths in 24 hours. Outside, the line of patients begins before dawn.
I don't know what's going to happen.
From a distance, we spoke with Ignacio Ramirez, who started feeling symptoms on Sunday. He waited 5 hours in line to get tested.
I have fever, a terrible headache, doesn't stop. It's horrible.
Overnight on Fox News, President Trump casting doubt on the number of ventilators that are being requested in New York.
But I have a feeling that a lot of the numbers that are being said in some areas are just bigger than they're going to be. I don't believe you need 40,000 or 30,000 ventilators.
And this from the White House Coronavirus Response Coordinator on the scope of the crisis coast to coast.
To make the implication that when they need a hospital bed, it's not going to be there, or when they need that ventilator, it's not going to be there. We don't have an evidence of that right now.
The city's EMT response now approaching a crisis, with a spike in 911 calls causing up to 3-hour delays for ambulances and non-emergencies.
In 2 weeks, we have a 20% or 30% people out sick.
Across the country, major cities are starting to see an increase in coronavirus cases and brave doctors risking their own health. In Atlanta, anesthesiologist Dr. Michelle O is intubating critical COVID patients.
You're aware that every moment you're spending in this airway, you are possibly aerosolizing this very infectious virus.
Her husband is also a physician. They have 3 children. Every day, she worries about carrying the virus home. This past weekend, she and her husband redid their will to make sure their children are cared for in case they don't make it.
It is a real possibility now that we could lose one or both of us. It's affected our home life, it's affected our work life, and there's really nothing that's separate from the virus at this point.